Should ensure that the child is awake.
Awake?
The child is not sleeping or in a drowsy condition. So to wake up a baby or an infant, just rub the sole of the feet or at the head where there is a soft pad. Then the baby will just wake up due to twinkling. You position a baby through placing the dominant hand. Either you want to put it on the left or the right breast. If is in the right breast, ensure the right hand touches the buttock of the baby. Then the head should lie on the elbow, while the other hand is touching the breast of the baby. The complication that normally comes with a child not breastfeeding enough milk, just dehydration, which may lead to other complications. Like kidney diseases. Confirm the symptoms of dehydration. A baby may present with, you see, the upper part of a baby at the head here, normally should be level with the head.
Hi guys, welcome back again to my YouTube channel. My name is Naomi Njoroge, and today I have a very interesting topic that I want you guys to learn. It's all about maternal health and all about the positioning and attachment during breastfeeding. I've come along with my friend and he's going to introduce himself.
Hi guys, my name is Rodin. I'm a nurse registered.
First of all, I'm going to ask him several questions so that at least the viewers can get to have a clear view on what is breastfeeding, the importance of breastfeeding, how to attach, to position, the complications that come along with breastfeeding to both the mother and the child. So Rodney, if I may ask you, you can explain to my viewers what is breastfeeding?
Breastfeeding is the act or the procedure of giving an infant or a baby milk from a breast.
So it's the procedure or the act of giving milk from the breast milk.
Yeah.
That is from the mother, right?
Yeah.
And what is the importance? Because some mothers may ask, or everyone may tend to ask, like, what's the importance of breastfeeding?
Breastfeeding is the act of giving milk to a baby. That means breast milk is an ideal food for an infant. It has several roles or importance. One of it being it has antibodies that help in fighting the common childhood illnesses. The second one has nutrients that helps the body, like protein, which helps in bodybuilding, carbohydrates, fats, mineral salts, water. Each has a role.
So I think the next step, you're going to show us on the proper positioning and how a mother can possibly position the child during breastfeeding.
During breastfeeding?
Yeah.
Okay. So a mother should ensure that the child is awake.
Awake?
The child is not sleeping or in a drowsy condition.
What if in cases where the child is asleep, like how can you wake the child up?
Usually a child will just wake up when
they're hungry.
Yeah. But in case they are still asleep, that is in cases of a neonate who is 0 to 28 days, normally
neonate is the one 0 to 28
days. Okay. Then an infant from 28 days, 29 days to 12 months.
Which is 1 year.
Yeah. So a neonate normally tend to sleep throughout. So they'll need to be woken up. So to wake up a baby or an infant, just rub the sole of the feet or at the head where there is a soft pad. Then the baby will just wake up due to twinkling
so
sensation.
The mothers who pinch, The mothers who tend to
Yeah.
maybe pinch the babies when they're trying to wake them up.
That's hurting a baby.
That one is hurting a
Yeah,
baby.
baby.
So they should actually rub the sole
Yeah.
or they rub the head
Yeah.
to wake the baby up.
Yeah.
Definitely, you've said the baby will automatically wake up if they're hungry.
Yeah.
Okay, that's point
Then the
number
second thing,
Yeah.
just the baby is awake or is alert, and then you position a baby through placing the dominant hand. Either you want to put it on the left or the right breast. If is in the right breast, ensure the right hand touches the buttock of the baby. Then the head should lie on the elbow, while the other hand is touching the breast of the baby. This one will help in directing the nipple into the mouth of the baby.
So point number 2 is you ensure that your palm is holding the buttock
Of the baby.
And then the head should be on the elbow,
Yeah.
should be on the right angle.
Yeah.
And then you should ensure you hold your breast. There are different ways that mothers hold the breast. Like, what is the right way to hold your breast when breastfeeding?
Just holding is either through the C. You make a C. First
The
hold
C shape, yeah.
hold the whole breast, or through the
Two fingers.
fingers in between, so that you can position the nipple in between.
So the 2 fingers are used for positioning,
Yeah,
right?
yeah.
The moment you use the 2 fingers to position, you're going to use now the C shape,
Yeah.
where the 4 fingers go under the breast, and then this one is to control the breast
Yeah.
during the suckling.
Yeah.
Okay, that's point number 2. We go to point number 3.
Point number 3 is that you ensure that the baby is sucking enough. By ensuring that the baby is not making noise, that is through sucking, like
They're not making any noise, like they're not inhaling air.
now that making noise is that means the inhaling some
Yeah,
air
okay.
into the stomach, which will bring some other complications that we'll talk later.
So to prevent that, you have to ensure that the baby's mouth is wide open, right?
Wide open.
And then there's always that dark part in the
You ensure that is inside the mouth of the baby.
mouth. So when the baby's mouth is wide open, the dark part should be inside the baby's mouth. Like
Yeah.
wide open, and then the baby's mouth should fit the dark part, which
Okay.
is called the areola.
Areola.
Yes.
Okay. Then your mind should settle on the baby, not in other things.
So you should mentally focus.
Focus on your baby while breastfeeding.
Because actually, in some cases, when you focus on your child, the breast milk tends to come out automatically.
Yeah, you see, the breast production is all about facilitated by hormones. By concentrating on a baby, it will facilitate
Hormones.
hormones to act on the breast production.
I mean that could be the reason where people say when a mother is stressed or when a mother is not in a stable condition, the breast milk tends to be low, low breast milk production, because everything starts from mentally, and then it affects the hormones that produce the milk, and that tends to have low milk production, right?
Yeah.
It's okay.
I guess then you place your child for almost 10 to 15 minutes on one breast. Then after that, you change again. Then you same procedure, holding the dominant hand holds the buttocks, while the other one directs the nipple into the mouth of the baby.
So mothers should not be in a hurry to always
Yeah.
You know that those mothers who they want to breastfeed, and then after they finish they want to go and other things. They should create time for their babies. They ensure that the baby suckles that breast for almost 10 to 15 minutes before turning them to the other breast. Okay.
At least 30 minutes.
The whole procedure of breastfeeding should
least,
take around
at least 30 minutes. Yeah.
So that one concludes the whole part of proper positioning
and attachment of the baby.
Okay. So you said you should sit comfortably, ensure the baby is awake. You have already demonstrated on how you should wake up your baby. You should ensure the head is on the right angle and the hand is in the buttocks as you were shown. The hands should be on the buttocks and the head should be in the right angle. And then you should ensure the baby is facing you and they should always be awake. And you've already been demonstrated the right way to hold the breast, right? You should hold it in a C position. 4 fingers under the breast and then the other finger above the areola. And then ensure the baby is awake to avoid choking, because choking can actually cause death. So I think we're going to also elaborate on what are the effects that may come with not breastfeeding, like the negative effects that come along with not breastfeeding to both the mother and the child, the complications that come along.
I think before that, we may talk about normally at around 2 a.m., 1 a.m., a child normally cries, is irritable. I think,
Naturally?
Yeah, not naturally. That's not being naturally. But a baby normally cry or because of the mother not being attaching the baby very well in the nipple, leading to accumulation of air in the abdomen, which may cause some disturbance or discomfort to the baby, thus crying.
During at the around 1 a.m. 2 a.m.
Yeah, 2 a.m. That is normally happens before the child reaches 3 months.
Okay.
Then the complication that normally comes with a child not breastfeeding enough milk, just dehydration, which may lead to other complications. Which may lead to other complications like kidney diseases. Mostly the immediate affected organ is the kidney.
So before you continue, the dehydration comes along because breast milk contains enough water.
Yeah.
So if the child is not breastfeeding, they do not get enough water.
Yeah.
So they become dehydrated.
Yeah.
And that one may lead to other complications, which is?
That is the most common affected is the kidney.
So the kidneys are affected if the baby doesn't actually breastfeed.
Yeah. And then you can confirm this, the symptoms of dehydration. A baby may present with, you see, the upper part of a baby at the head here, normally should be level with the head.
The upper part.
Yeah, not inverted or
outward.
Yeah. If it's upward, it means other thing, which is related to the brain. That is the fluid that is in the brain is increased.
Oh, so that one is the one that results to the.
Yeah. No. The movement is there is a blood vessel in here that normally shows that blood flow to the brain. But normally when it's upward, it means there is a problem with the brain. There is fluid which is increased in pressure. That needs to be handled by a certain specialist called a neurology or a neurosurgeon. But when it's inverted, it means that the baby doesn't have enough water in the body. Yeah. Then the baby should be taken immediately to the hospital.
So that is one of the signs of dehydration.
Yeah.
The other sign is the skin. What about the skin?
The skin will be
pale. Is it pale?
No, but leave alone with the skin. But the skin, the eyes will be sunken. That will be there will be a depression, or the eyelid will be inverted.
That is because of dehydration.
Yeah. Then if you look at the lips, they will be dry.
Dry.
Yeah. Then if you pinch a skin, normally should take less than 2 seconds when going back. But this one will take longer than that. Yeah.
So you have said about this part being either up or down?
Yeah. No. The one of the signs should be downwards. Upwards is another disease.
Oh, downwards is for dehydration.
Yeah.
Upward is for another disease.
Yeah.
So normally it should be flat.
Yeah.
And then the eyes, they should not be sunken.
Yeah.
The lips should not be dry, and then the skin should not be stretchy. So those are the signs to show that a child has not been actually breastfed.
Of course, they should be irritable.
Yeah. To avoid, some mothers tend to complain of back issues after maybe breastfeeding. What's the right position to sit when actually breastfeeding? If you may demonstrate.
The right procedure, the right position of a mother during breastfeeding, the mother should ensure that she is comfortable and should sit in an upright position, so that upright with the shoulders
Relaxed.
relaxed,
Yes.
not this way.
Not lifting your shoulders up and
yeah.
trying to lift the breast.
Then ensure your back is comfortable.
So they can actually use a pillow.
You can use a pillow just to be in
back.
a upright position. Yeah.
So ensure that their shoulders are relaxed and ensure that they have something that is supporting their back at the end. They can maybe put a pillow or something, and then the way they hold their breast also matters, right?
Yeah.
During the positioning.
Yeah.
Sit upright, comfortable. You can use something to support your back to prevent back issues. The other thing is there are complications that tend to come along if a mother doesn't actually breastfeed. They tend to have breast issues. What are the things that you can say that come along with not actually breastfeeding in terms of mothers? The complication that mothers get actually not after breastfeeding?
A mother, the immediate complication normally that the first time mothers is the inverted nipples. That is called breast engorgement.
So breast engorgement is the inverted nipple. The nipples that tend to be flat and inverted.
Yeah.
And how do you solve that?
So that one, during antenatal clinic before mother delivers.
The antenatal clinic is before mother delivers.
Yeah, they tend to be taken into a session that helps in
getting
the
inverted nipple to come out.
Yeah.
If we may term to
Yeah.
say that.
Yeah.
So that one actually happens or is treated during the antenatal clinic visits.
Yeah.
Okay.
Then there is mastitis. There is an inflammation of the breast due to infections. That is can be related due to hygiene of the mother.
So mastitis is related to hygiene.
Hygiene issues. Then there is production of milk. Can be a lot of production of milk just can cause also the mastitis.
I think also the mastitis comes along if the mother doesn't actually breastfeed now and then. So the breast tends to be fuller now and then, and that one can cause mastitis, and it tends to be very painful.
Yeah.
If a mother doesn't, how many times should a mother breastfeed? You know, some mothers don't know. They may think they breastfeed in the morning, at lunchtime, in the supper. Like, how often should a mother breastfeed?
A mother should just breastfeed as often, even if it's about 5 minutes after breastfeeding, the 30 minutes.
That one depends on the demand.
Yeah, the demand. Baby. Yeah.
Okay. What is the other complication that can come along with not breastfeeding for mothers?
Maybe a mother who is not mentally fit can lead to psychology issues. Basically, due to social issues, maybe financially not getting a supportive partner. Yeah.
And sometimes, do you think replacing breast milk and formula is advisable for mothers?
It's not advisable because the formula or that milk that has been bought in terms of powder doesn't have all the nutrients that a baby needs. But in case it reaches that point, it's better to avoid some complication like baby not having enough energy due to feeding.
So what are the reasons that the nurses may prefer to giving the child a formula? What is the main reason that can make someone to give a child formula? Is it when the mother is ill, or when the mother is not able to breastfeed, or what causes you give an option of giving the formula to the child?
I think I tend to think a mother can't be able to breastfeed her baby. But if a mother can't produce enough milk for a baby, that's when we supplement.
You supplement
with the formula.
Yeah. And in terms of nutrition, for me, I always tell mothers, the best way to increase your breast milk is taking liquid and the hot stuffs. You can take cocoa, you can take a soup, you can take milk. As long as it's fluid, with time, the milk production tends to be high.
Yeah.
And then in matters, as we discussed earlier, in terms of stress, when you're stressed, the breast production tends to go low.
Yeah.
And what are the other complications that may affect the child if the child is not breastfed? Like what comes along with negative issues when the child is not breastfed?
An immediate complication is when a baby may present with being irritable, crying.
Yeah.
That is abdominal pains, which
That's
comes about.
probably because of hunger and not being breastfed with time.
No, it's because of the baby may be inhaling some air into the stomach during breastfeeding when is producing or he or she is producing some sounds.
Okay. So during
So this one can be overcome by after breastfeeding the mother, you put your baby into one of the shoulder, then you rub,
or that one for the air to come out.
so that it can bulge that air.
That one will prevent having some complication.
Yeah.
The other complication you can have in a child if not getting enough breast milk.
Probably it's dehydration because breast milk contains water, which if you see, a baby contains almost 80% of our body is fluid or water. So if you lose like 20%, that is, baby will develop dehydrated, which will lead to other complications like kidney. One of the deadliest complication or one of the things that may lead to mortality is dehydration, which may not only dehydration but may accompany with the infection of the child or an infant. That is, a child may present with vomiting or diarrhea. That is, vomiting may vomit 2 episodes or more. Diarrhea may basically is just a loose stool that is 2 or more in a day. A child, if may present with that signs, please ensure that is taken to an hospital, a nearest hospital for management.
So I think that comes to the end of our topic today. We have discussed many things about positioning, about attachment, what else? About complications to the mothers, complications to the child, signs that may show you that the child has been well breastfed. Those are the 5 topics that we actually discussed today. They're actually about maternal health. It's very beneficial to all mothers and to get to know about this because breastfeeding is very important. I always say from 0 to 2 years, you should actually breastfeed your child because breast milk is everything. From 0 to 6 months, exclusively breastfeed your child. Do not include anything in the diet. You know, there are some mothers who tend to say like, I will breastfeed for 3 months, then I will introduce food at the 4th month, 5 months, 6 months. You should actually breastfeed from 0 to 6 months, exclusively breastfeed. The milk is actually enough for the baby, right? From 0 to 6 months. And then from the 7th month, that's when you can introduce other food. That one is called complementary feeding. That's when you need to see maybe a nutritionist to guide you on the different food you can actually give your baby. So I think that one comes to the end of our topic today. You can actually share, you can comment, you can like what else you want us to discuss about the maternal health, and we'll actually be there to discuss with you guys, for the viewers, and do it for you.